If you take good care of yourself, you will feel wonderful during pregnancy. Dr. Manjeet Arora gives you tips on what to do for a healthy pregnancy.
Pregnancy is a very important event in any woman's life, but there are certain do's and don'ts of pregnancy which they should take care before getting pregnant. This is an era where everybody is educated and wants to know whether it is the optimum time to get pregnant, whether there are any concerns that they should work out before getting pregnant, or if there is any treatment, if they are having any diseases already, they should be treated optimally so that they can have the best outcome. So what I recommend, that if you are planning for a pregnancy, it is a good idea to see the doctor, both husband and wife. They should be evaluated thoroughly as regards any history of babies being born with some defects in any of the families, mother having any chronic problem, or if she is having any diabetes, hypertension, or any history of bleeding disorders, thalassemia traits, or weight related issues, if she is obese, or other things if they are pre-existing. We must evaluate and we must find out what is the best time for them to become pregnant. And for husband also, if there are any concerns in the family, any twins, any malformations, anything which is significant should be looked into. Other important thing which is there is the role of pre-pregnancy vitamins, which is very important, is folic acid. Every woman who is trying to become pregnant should take folic acid supplement at least 3 months before and should continue 1 month after she becomes pregnant. Folic acid is known to reduce the neural tube defects. What we earlier used to hear, a baby without the head or baby with the swollen head or hydrocephalus or other neural tube defects, it has been shown if they take these supplements, the neural tube defects can be reduced to less than 5%, and which is a great achievement. If she does not have any concerns, we can just explain them that what they should expect when they are pregnant, how to test for pregnancy, what are the common symptoms they will experience during early pregnancy, and what the precautions they should take, and if there are any warning signs, if there is any bleeding or any pain in the tummy, they should go to the doctor. When the pregnancy has been well established, there will be certain tests which are routine for pregnancy. These are called routine antenatal investigations. The doctor will advise them about those investigations, besides a thorough checkup that there are no underlying heart disease or any other problem which needs a special mention during pregnancy. During the first trimester, which is from conception to the 13th week, a woman is generally given folic acid, and if the need be, sometimes Ecosprin and the medicine to control the vomitings. These medicines are safe because the frequency of nausea and vomiting is very common, and the way the lifestyle is changing, the younger mothers are not able to cope with the reassurance or easy go attitude. So they need sometimes these medicines. So they are prescribed and they are taken under supervision. We tell them to get up in the morning and may take dry toast, biscuit or rusk to avoid nausea and vomiting. Keep them hydrated, and if these things do not help, we tell them to take medicines at regular intervals to keep nausea and vomiting under check. Then comes how they should be clothed. They should wear easy clothes, cotton clothes, should try to avoid wearing heels. Then come about journey. They should avoid bumpy roads. They should avoid travel by autos. Smooth journey is not a contraindication. Regarding what work they can do, if there are no other issues, she is having a normal healthy pregnancy, they are allowed to do their normal household routine activities, but we recommend that they should take good 8 hours sleep at night and 2 hours rest in the afternoon. Regarding diet, they should take well balanced diet. Regarding constipation, which is a very common symptom during pregnancy, they should take plenty of water, high fiber diet, and eat enough. Then they should be aware that if something like having too much of vomiting, not able to retain anything, or there is any discharge from the vagina, or there is any bleeding, or any unusual symptom, pain in the tummy, they should seek the help of the doctor. Regarding pain in the legs, which is a very common phenomena because the blood volume increases, so common complaint is there. So they can lie down, keep a pillow under their leg or hip, and it should give them some relief. Regarding sexual activity during pregnancy, people are generally very shy to ask whether they can have normal relations or not. The beginning of the pregnancy, if there is no previous history of any miscarriages or any complicated pregnancy, one does not restrict sexual activity, but the mood and desire of the woman can vary. Sometimes because of excessive fatigue and tiredness, she may not be having a good libido, but these things they improve during as the pregnancy advances. And if there are any concerns, one should feel free to discuss with the doctor rather than remaining shy and following what the friends are saying. Only way, if she is having bleeding or it is causing pain, hurt, these are the times when we say that you can avoid these marital relations.
For more videos related to pregnancy and health, log on to onlymyhealth.com.